Hello everybody, Dr. Brad here. I'm a Burlington chiropractor at Life Chiropractic Center, and today we have a very special treat for you. I'm going to demonstrate to you how I adjust a baby. And with me is baby Gordon. He's been adjusted since he was 4 months old, and he's now 11 months old. And first of all, how do I know when a baby needs an adjustment? Well, first of all, I'm going to check with mom to see what happened since last adjustment. Have there been any falls? Has he fallen off the couch or off his change table? Has he had any colds? Is he teething? Are his bowels moving properly after he feeds? Have there been any recent vaccinations? And of course, we want to pay particular attention to the big developmental landmarks when he starts to sit and then crawl and then stand and then walk, because any of these circumstances can create situations where spinal misalignments and subluxations can arise. And of course, I do a physical checkup before each adjustment, and I take information from mom and from my physical checkup, and this is how I know if he needs an adjustment and where he does. So this is what we're going to do for you today. So we're going to put baby Gordon into the pregnancy pillow here, and this pillow I use to adjust pregnant moms, but it also serves as a good tabletop cushion for babies. And the first thing I'm going to do is check to see if his head is tilted to one side or the other. And then I'm going to have him grab my fingers and I'm going to gently lift. This way I can check his grip strength and make sure his neck muscles are developing properly. And then I'm going to check his legs and his hips to make sure that we have flexibility and there's no tension in here. And I'm also going to do a leg check, and this is my most valuable tool for assessing for subluxations, because if one leg is tight and pulling up short, then I know that he has a spinal misalignment. And I'm going to reach around behind and I'm going to check the various areas of his spine to make sure they're moving properly. So when we check baby Gordon today, his right leg is about 1/2 inch short, so that indicates that we need to adjust primarily the right side of his body. And how I do that, I'm going to use an activator, and an activator is an instrument that will make a very gentle impulse as I squeeze it. And what I do is I will put my finger on the vertebrae that needs to be adjusted, and I will give it a couple squeezes in the direction that I think the vertebrae needs to be corrected. So here we go. We're going to start with his atlas, which is his very top vertebrae. My thumb is on his atlas. We're going to give a couple of clicks. We're going to check the leg lengths again, because this will let me know if we have a complete or partial correction. And we still need a little adjustment, and this time will be in his pelvis. And remember, the pelvis, which is posture quadrant number 3, is very important for stability of the whole spine. So his left sacroiliac joint needs a little click, and we're going to do one little adjustment right between his shoulders, right there. And our final checkup. And leg lengths are perfect, and his spine is now in much better alignment. Thank you. And when the spine is in good alignment like this, that means that his neurological system, his brain, and his spinal cord and nerves can effectively communicate with his body, and this makes for a healthy baby. So thank you very much, baby Gordon. And if you have any questions on this topic or any other health concerns that you may have, or anyone in your family may have, especially your children, you know the routine. Please give me a call. Remember that consultations in our office are always free of charge. We do offer family appointments where we can check your children all at the same time. Office hours are Mondays, Wednesdays, Thursdays, most Saturday mornings, and our phone number here in Burlington is 905-335-5433. and we'll be sure to talk to you all again next week.